Good afternoon. My name is Amy Blum, and I'm the Chief Operating Officer here at the National Gaucher Foundation. It's an independent nonprofit dedicated to serving U.S. patients with Gaucher disease and their families. Through financial support, educational programming, patient services, and collaboration with medical professionals, the NGF empowers Gaucher patients to live a better today. To learn more about Gaucher disease and the work of our foundation, please visit gaucherdisease.org. So today's webinar focuses on a very important topic for parents and adolescents who have Gaucher disease, that being imparting self-determination skills necessary for transitioning independently to managing their health. Okay? And I'm excited to introduce to you this afternoon our special guest, Lori Bailey. Lori is currently the Clinical Research Manager at Cincinnati Children's Hospital in Cincinnati, Ohio. And although she was trained as a genetic counselor, receiving a master's in medical genetics from the university in 1995, she's also become involved and is interested in the study of Gaucher disease. And in 1999, she took a position coordinating the Comprehensive Gaucher Disease Treatment Center underneath the leadership of Dr. Gregory Grabowski. She's participated in the management of over 100 children and adults with all types of Gaucher disease and has coordinated both interventional treatment trials and clinical research to advance the knowledge of Gaucher disease and to strive for better outcomes for those affected by the disease. She has been an advocate for those with Gaucher disease, providing education on the treatment and management of the disorder by speaking at patient meetings, national meetings, and advisory boards. She currently oversees the Rare Disease Treatment and Management Team within the Division of Human Genetics, where they promote the qualities of their STAR program to provide support, treatment, advocacy, and research for both children and adults with rare genetic diseases, including Gaucher. Lori, welcome to our webinar, and thank you again so much for joining us and creating this wonderful presentation.
Well, thank you very much. So first, I'd like to say hello to everyone out there. You cannot see me. This is the hard part, but I want you to know that there's a giant smile on my face as I begin the discussion with you about a topic that's near and dear to my heart. So first, I'd like to thank the National Gaucher Foundation and AvroBio for giving me the opportunity very scary idea of our kids growing up and having to take responsibility for their own health care. Something that you have tackled as parents, pouring so much of yourself into understanding Gaucher disease, its treatments, and making sure they didn't miss a single infusion or other appointment. It is not unusual to be fearful that everything you have worked so hard to achieve will be lost because you no longer have control over this aspect of your child's life. I want to assure you that this is the last thing that the healthcare providers, you, and really your child want to happen. It makes sense that this handoff of taking care of your own medical needs should be seen as a transition. Today we're going to talk about this transition, the process, the milestones and timing, and provide an example of shared decision-making and how that all works. So looking at this, it's about growing up. This cartoon illustrates what I think most parents and kids grapple with. How can you tell when a person officially becomes a grown-up? Is it when they finish school? When they get married and have kids? And the child answers, when they stop blowing bubbles in their milk. I think that for parents of a child with a chronic condition like Gaucher disease, one might argue that he or she is officially a grown-up when they can manage their own healthcare and effectively use healthcare services. Ultimately, we want them to stay healthy. The first thing then that we must do is understand what a transition in the healthcare arena means. It is not simply a transfer of care. It's a lot more thoughtful and complicated. A transition is defined as the purposeful, planned movement of young adults from the pediatric healthcare system to the adult healthcare system. whereas a transfer is defined as the discrete event of changing from having a pediatric primary care provider to an adult provider. One can think of the many dimensions of transition. For example, you could have transition from a pediatric care specialist to an adult specialist. This may actually require going to a new institution. This could also be a different provider at the same institution. In some institutions, the providers are the same for pediatric and adult patients, but there is the transition from the parent being responsible for medical care to the young adult taking on this responsibility. This is a big change and a big responsibility for parents, young adults, and healthcare providers. I like to compare this to a teenager learning how to drive. Most would agree that it would be crazy to hand over the keys to a car on a teen's 16th birthday and say, "Good luck, don't crash." No. We, in fact, begin teaching kids to drive at a much younger age. They observe us drive. They study a book to learn the rules of driving and take a test to get a permit. They may attend a driving school. They practice with other adults. They drive in the city, in the country, and on the interstate. They get a license, but they may only drive at certain times of the day or with certain people in the car before they're actually given the full responsibility of paying for gas, paying for insurance, repairs, and driving across the country. Transitioning responsibility for healthcare should be similar. It's important enough that we should let them observe, become educated, practice, and slowly take on all responsibilities related to managing their own health. So that brings us to a transition goal. The first thing we have to know is everyone must take responsibility for their own health care and grow up. But for young adults with Gaucher disease and special healthcare needs, it can be more complicated. However, together, every young adult can manage their own healthcare. So what might this transition strategy look like? There are many ways to personalize and optimize each teen's transition, but all plans can be broken down into these overriding stages: the creation of a transition policy or a plan, tracking and monitoring of your goals, education, creation of the transition file, and finally, the official transfer of care or graduation. So let's talk about each one. First, we need to understand the difference between pediatric and adult models of healthcare. This is not completely true at every institution, but broadly and generally, the following are true across the United States. In a pediatric population or provider's office, it's a provider and parent-controlled environment. They provide comprehensive, multidisciplinary clinics, often known as one-stop shopping. They have case management and lots of social work support, and the families are supported through the entire process. Contrast this with adults, where the patient must be responsible. Multiple providers are involved and care for very separate issues. There may not be as much social work or case management assistance that is provided, and the patients might have to be proactive to get the services they know that they need. So what's the first step in beginning to teach your teen and young adult how to tackle this problem? So many would say, it would be wonderful if every facility that cared for pediatric patients had a written policy on the transition to adult care. I would say more often than not, you may not find a written policy. But you could begin this process and come up with one on your own and share it with your healthcare provider so that everyone has an understanding of the importance of a transition plan and how it should be done. A transition plan should be, in its most purest and wonderful form, a written agreement between a healthcare provider, the family, and the young adult. And it must and would be best if it included input from all parties. It should tackle the issue of privacy and consent issues that occur on the day the child turns 18. And it should talk about the difference in timing. An early transition plan, when maybe it's at 13 to 14 years old, what might be different in a middle transition with a 15 to 17-year-old, and then the final late transition phase greater than 18 years of age. This plan might define the parent and child responsibilities during the transition, and most importantly, it should have a goal, an end date, a graduation date. I found an example of a transition policy online, and I thought we might share some of how it works. So some practice is committed to helping our patients make a smooth transition from pediatric to adult health care. This process involves working with youth beginning at age 12 to 14 and their families to prepare for the change from a pediatric model of care where parents make most decisions to an adult model of care where youth take full responsibility for decision making. This means that we will spend time during the visit with the teen without the parent present in order to assist them in setting health priorities and supporting them in becoming more independent with their own health care. I like this because it defines what is actually happening and what and why we're doing this. We can't forget that in addition to helping our children grow up, there's actually a legal reason why we have to do this. This could also be part of the policy or plan with your child, just to make it known that at age 18, youth legally become adults. We respect that many of our young adult patients choose to continue to involve their families in healthcare decisions. Only with the young adult's consent will we be able to discuss any personal health information with family members. If the youth has a condition that prevents him or her from making healthcare decisions, we encourage parents and caregivers to consider options for supported decision making. Ultimately, we need to set some dates and make sure that no one feels alone. So we go on to say that we will collaborate with youth and families regarding the age of transferring to an adult provider and recommend that this transfer occur before age 22. We will assist with this transfer process, including helping to identify an adult provider, sending medical records, and communicating with the adult provider about the unique needs of our patients. And as always, call with questions. So I think this really puts down what is needed. We need input from all sides. This can't be done in isolation. The healthcare provider has to be on board and agree to do some of the activities. So once you know that you have a policy and you know it's going to happen, what do you have to do next? So I think of this as the tracking and monitoring step. So in this, there are many assessments that are available online and many sources that I'm going to show you some examples of in a little bit, but really it's a skills and readiness assessment. You could begin this, say, at age 14, and the important thing is you need to answer the questions at age 14 and then regularly reassess it to see how they change, because they're going to be ready for different activities, different milestones as they get closer to a fully competent adult stage. So for each person, it might be different what the milestones look like, because they might have skills and limitations that make it so that you need to alter this plan. But once we identify the milestone, for each skill, we need the teenager to say, yes, I know this, or they need to say, I need to learn it, or someone needs to do this, but who? I'm kind of clueless. Also, things to consider putting into the assessment plan is, what are their plans? What are they doing after high school? Are they going to college? Are they going into trade school? Or are they going right into the workforce? What kind of career choices are they trying to make so that we can tailor the education to the choices that they're making? So what kinds of things might be in this assessment? So here are some questions that you might think about addressing. The child or the teenager would say, I know my medical needs. What's the answer to that? Can they answer that? Can they explain their medical needs to others? They have to answer questions such as, I know my symptoms, including ones that I quickly need to see a doctor for. I know what to do in case I have a medical emergency. I know my own medicines, what they are for and when I need to take them. I know my allergies to medicines and medicines I should not take. I know that it's important to carry important health information with me every day. My insurance card, if I have allergies, what medications I'm on, emergency contact information, maybe a medical summary. I understand how the healthcare privacy changes at age 18 when legally an adult. I can explain to others how my customs and beliefs affect my healthcare decisions and medical treatment. Other things that should be considered are whether or not the young adult can use our healthcare system. So what might that include? They need to be able to answer whether or not they can find their doctor's phone number. Can they make their own doctor appointment? Before a visit, do they know what kinds of questions to think about asking? They have a way to get to the doctor's office. They know that they need to show up 15 minutes before the visit to check in. They actually know where to go to get medical care when the doctor's office is closed. They know that they have a file at home for medical information. They have a copy of the current plan of care. They know how to fill out medical forms. They know how to get referrals to other providers if needed. They know where the pharmacy is and how to refill medications. They know how to get their blood work done, x-rays, MRIs, whatever they may need for their monitoring plan. In addition to having like a checklist of whether or not they actually have these skills, there should also be a dialogue to help guide the development, there should be a dialogue about the concerns regarding transitioning to taking care of everything by themselves. And these could be very different depending on the child. Some concerns that maybe need to be brought up are whether or not the parents, they're just concerned that their parents won't let go and make the transition on my own. They're worried that they want to be independent, but they're having trouble dissociating from their parents. Maybe they're worried that they won't know the difference between an emergency and a minor illness. Maybe they're concerned that they won't know who they should call, their primary care provider or their Gaucher specialist. They're worried that they won't be able to manage the treatments. They're worried that things will be different when they do it on their own. Maybe the nurse does things differently than they're used to and they won't know how to talk to him or her. Maybe they're worried about making appointments. Maybe they're worried about maintaining insurance coverage and doctor's bills coming in. All kinds of different concerns that they may have, and it may be different for each kid, and it may be different at different points of time in their life. So the answers that the teens provide on the assessment can help guide the development of a personalized plan that addresses their unique needs, worries, and concerns. It's important to reassess the skills and concerns at least annually, as the worries can and really should change over time. So here's an example of a timeline. Like, when do you start doing this stuff and what do you start doing when? Maybe at age 14, you start to understand the basics of Gaucher disease and how it's treated. At age 16, they should be able to talk to the healthcare team, teachers, family members about Gaucher disease and its treatment, and understand the medications that are used to treat Gaucher disease. By 18, they are officially an adult and have the right to make their own healthcare decisions. Do they understand insurance? Do and can they provide consent for research? At age 21, the transition to an adult provider should be complete, and they should understand all the billing and insurance issues. So again, this is just a timeline for a generic person, and perhaps one child can do this faster, and maybe another child, it's going to take them more time to get to this point. So the answers to the assessment questions, the concerns, and the idea of a timeline in your head may provide you with insight on when they're mature enough to begin each step of this process. Once you've done that, you kind of have a roadmap for where you're going. The next step is to begin providing the education needed to help the teen reach each defined milestone. They will eventually need to have an understanding of Gaucher disease. Perhaps we need to create a one-page summary of the condition. They can use that summary of the condition to give to future healthcare providers when necessary. I've often found in high school they take a human genetics course and they get to research a genetic condition. It's really nice to be able to research something near and dear to your heart, and so many of our patients have chosen at that point in time to research Gaucher disease and write the summary at that point in time. They need to have education on medications, a one-page summary of their own treatment history. When did they start? For ERT, did they have multiple ones and start and stop dates of each? Did they ever take an oral treatment or an SRT? What kind of reactions did they have? And what were the treatments for that reaction? And then, of course, any other medications that might be used for Gaucher disease or any other medical condition that they might also be treated for. It's really important to provide understanding of monitoring. What's their particular treatment plan? How often are the various tests like blood work, MRI, DEXAs to be done? Why and where are they done? And then ultimately they need to have an understanding of insurance. They need to have a basic understanding of the terms, where to go to get questions answered, types of questions to ask when it's time to get a new insurance policy. As you get closer to the graduation time, the teen should be armed with all the information they need to be successful. In today's day and age, it probably makes sense to put this information on a portable electronic device. We all know that as parents, we were forced to become experts on Gaucher disease when the child was diagnosed. It's not uncommon for patients and families to be more knowledgeable about Gaucher disease than most of the healthcare providers they will encounter. So why not make it a little easier for them? Take this USB or flash drive or whatever the latest and greatest electronic devices of the day, put the condition fact sheet on there that's easily accessible, put a summary of the medical history with surgeries and major illnesses, include the response to the various therapies and what they're used for, and then provide examples of questions that the teen may ask at each appointment to get them thinking. Provide a list of the healthcare team members and what they do, why they see them, and of course, the monitoring plan that they're supposed to be following. So in order to create this, I really think it's beneficial to work with the Gaucher specialist, a genetic counselor, or other nurse to create these files together to make sure that it's included when it's time to fly from the nest. And then finally, it's graduation day. You guys had set a goal for by this age, we would have all of these things done. Each young adult should be able to take the assessment they took at the beginning and confidently agree that they can do everything and know where to go to help them be successful. So do we expect you to do this on your own? Absolutely not. I can tell you that as I was going through and putting this presentation together, I got more ideas to help with our families from some of these resources that I've listed here. I want to put a huge plug in for a book that was written by 3 individuals, Dawn Laney, Nadia Ali, and Carol Ogg. It's called Transitions, Growing and Managing Your Own Healthcare, What Every Teen Living with an LSD Needs to Know to Manage Their Healthcare. And then I'll show you a picture of that in a second. There's a website called gottransition.org. It has tons of information on it, examples and explanations to help teens understand each of these issues. And then there's another resource called Transition to Adult Healthcare, a training guide in 3 parts from the Weissman Center, the University of Wisconsin. This is a great resource if your teen has maybe some more issues related to cognitive functioning, and they really address some of the nuances of transitioning into the adult world if those are the problems that you have. But here's an example. This is a book that you can order off of Amazon. It's fabulous and wonderful, and I can't say enough good things about it. It has the assessments in there. It has information that is very specific to questions that a child with Gaucher disease may have. Again, I significantly support this book. I'm going to switch gears a little bit and start talking about decision making. So one concern that teens may harbor is having some apprehension about making choices that impact their own health outcome. Even though they're legally at age 18, they have the right to make their own decisions. It does not mean that they have to make those decisions in isolation. So let's talk about how we teach our kids to make decisions. I don't think it can be done alone. It must be shared between the healthcare provider and the patient. and then anyone else that plays a significant role in their life. And here we go with the process. So this shows you that everybody has to learn to make decisions and that you can apply this model anywhere in your life. But in fact, we will go through and each one of the items, the gather facts, brainstorm, the pros and cons, decide, follow through, define, and clarify. And this is the process that we go through each time we make a decision. The decision, the question we have is, should I or my child switch from ERT to SRT? Define and clarify. Define the decision that needs to be made. So we have the what is the question? When do we want it to occur? Why are we even considering it? Where are we going to do it? Who's in charge of making this decision and who does it affect? And how do we go about doing it? So the next is the decision. Should I or my child switch from ERT to SRT? We need to gather the facts. So from your healthcare team, what do you need? You need to understand how ERT works. You need to understand how SRT works. You need to explain what is known and not known about each treatment and explain the side effects. The patient, though, also needs to consider what is the burden of each treatment. What are your memories before you were on any treatment? How sick were you? What's your trust of the medical community? How about the drug company? How much fear do you have of getting sick or having symptoms related to Gaucher disease? And what kind of lifestyle and compliance issues might you have? How hard is it to take a pill and remember to take a pill versus ERT, which might be more burdensome, but you don't have to where you know you're getting what you need to get. You aren't as forgetful. So then we move to the next step. Should I or my child switch from ERT to SRT? You have to brainstorm. Okay, if I stay on ERT, what does this mean? If I switch to SRT, what does this mean? Maybe we should do a trial of SRT. You can never make a decision that you can't go back on, but you would have to define it. I want to try it for this period of time, and I want to see these types of effects without these kinds of side effects in order to know if this is the best fit for me. You would then make a list of the pros and cons of each choice, include the scientific facts and the emotional facts and burdens. Then you have to make a decision. But not only that, you have to follow through. To make the decision, you need to discuss it with the healthcare team. You need to discuss it with key family members and friends. You also need to follow through. Once you've made your decision, what do you need to do to contact your health insurance? How do you get a prescription in place? What kind of plan are you going to use to evaluate whether the decision you made was effective for you or if the side effects were too many? And then that brings you back to where you started, to define and clarify. After you've used a predetermined amount of time, you need to evaluate the decision. Maybe make some modifications to the plan, or maybe do something completely different. So that is kind of an example of where we're going and maybe a little bit of a guideline for how we can get there. Please know that it's really very individual and it's just a matter of creating the plan that works for you and your child. So at this point, I guess I open the floor up for any questions that you may have.
Thank you so much, Lori. This is incredible and very helpful. For those of you who may not be as familiar with Zoom and the technology that exists, if you were to scroll your cursor towards the bottom of your screen, you will see a bottom bar that pops up. And one of the options is a chat button. And if you click on that, you will have a side panel that opens with a chat. And please do feel free to put some questions in there for us, for Lori. And because Lori has her screen fully open and she's been giving this presentation, I'm kind of fielding the questions. So I've seen a few of these coming in. So Lori, we have a question about how do you transfer the self-administration of ERT treatments?
How do you transfer the self-administration of ERT treatment?
Right.
Meaning
So
that they,
I think so, Stacy. If I'm not on the right train of thought, pop something back in there again. But I believe what is being asked from the mom who is administering the the infusion, right, instead of maybe a home health care nurse or someone like that. And they're definitely not going to a treatment center. I'm taking this question to mean that they are in their home or wherever that location may be that's convenient for them. How do you help then teach the young adults to be able to administer the infusion him or herself?
Yeah, so I think it actually becomes a little bit more complicated than just the actual act of training them to administer it. That's the easy part. The first part would be kind of figuring out what they're going to do once they graduate from high school. Are they going to be, on the other side of the United States and completely without family and friend support? Are they going to be more local to the family? Then it sort of becomes who is managing that particular patient at that point in time and how comfortable they are with self-administration of the enzyme. And I know from experience that there are those that are wholly supportive and those that don't want to touch it with a 10-foot pole. So actually part of the plan would, if that was what was the goal, is to be able to self-administer the enzyme, would be finding a physician that was supportive of that way of administering the enzyme. So all of the decisions leading up to the decision to actually self-administer would be part of the plan that would have to be discussed and figured out. The next part would be, is that what the young adult wants, is to self-administer, or would they rather have some sort of nurse or facility at college or wherever they're moving to administer that enzyme at that point in time? But for me, the actual training of how to do it is the easy part. It's the questions to all that other stuff, or the answers to those questions.
Wonderful. So Stacy says thanks.
Okay.
Susan put in a question. And it relates to the insurance companies and that young adult being able to have conversations directly with an insurance company as they turn 18. So her question, I guess, isn't a little bit more ambiguous, but many of our young adults will stay on their parents' health care plan until they are 26. But they have the right to start discussing insurance options as they get closer to that point in time where they have to have their own policy. But one thing that I can share personally, Susan, is I have older children, and as they've gotten a little bit older and they may have questions that have to go back to the insurance company, I encourage them, and Laura, you may have a different point of view to chime in also, but I do encourage them to be on speakerphone with me as I'm having some of these conversations with the insurance company that pertain directly to their health or concerns about coverage, so that they're starting to get a sense of what those technical conversations may be like, and it may be less intimidating.
Yeah, but I completely agree with you. And the same is true for just scheduling their doctor's appointments. They can either start with being on speakerphone and hearing what happens, and then slowly transitioning to being able to initiate the call with a parent listening. But I wholeheartedly agree that you need to start that as a team before you transition to doing it by yourself.
Wonderful. So she says thanks. And then she had a follow-up, if they can make the call by themselves as of age 18. Yes, they can. And I have my youngest just turned 19, and she's sometimes still needs some coaching to it. So we just do it at a time that I can be there, kind of in the background. Then she takes the lead, and if she needs some help and for mom to kind of jump in, I can jump in, and I'm with her with that. But the reverse has been this the typical up until this point. So I hope that helps. These are not easy pieces to hand over to our young adults. Okay, so can we please explain what SRT means? They're only familiar with ERT. So thanks, Eric and Anna. Yes, so SRT stands for substrate reduction therapy. And ERT, as you know, refers to enzyme replacement therapy. Right now, SRT is only approved for adults, FDA approved for adults. So, Lori, do you want to jump in a little bit, or?
Yeah. So the SRT, and the reason that example was chosen is that it's an attractive option for many young adults, because, as you know, ERT is an IV administered product. SRT is oral. And so if you're taking a pill, that's a big difference than having to set up infusions, and kids going off to college often find that that's a more attractive approach. And so the idea for ERT is that ERT breaks down the material once your body has already stored it. SRT works from the other end. It works with your body's enzyme that it already has in it. It's just not there in enough, or it doesn't quite work as well, but it works with the enzyme to kind of slow down the production of the material that cannot be broken down, and hopes that the body's natural enzyme that's in their body can break it down for them. And so it's a relatively new treatment. It's only been out there for a few years, really. And so it often comes up as the first decision that these young adults are making, is what treatment they're going to continue with when they go off to college or they start their new adult life.
Right, thank you. And Eric and Anna, there is an entire page on the website that has some more information on SRT, and there's been a blog post that's there as well. So I can follow up with you later and help direct you to that. And Michelle also was talking about this topic because her daughter will, when she turns 18, her birthday is in August, right? And so that'll be just when would be starting college. So one concern that they have as a family is starting something new, like an SRT, when they're away from family. And I'm just trying to read through this in terms of side effects that might be going. So is there anybody that has experience in that regard or suggestions in terms of how to go forward with that?
Yeah, so my suggestion would be to start with the conversation with the healthcare, the Gaucher specialist that's kind of managing this, and talk about it and see what kind of options may be available. I know that in some cases it may be possible to start treatment. I could be like put in jail for saying this probably, but you could start treatment before the age of 18 if you're close to making that decision. See if you can get approval for it to make the argument to start it before going away to school. The other would be to put a monitoring plan in place that is very strict and has tighter timelines for checking in. But that's really a plan that could be made with the Gaucher provider to really come up with the best option for when to start that, if you want to start it, and if it's right for that particular child.
Wonderful. Okay, we have another question that has come in that the son is hoping to attend college out of state, and Matt is concerned that his son will get caught up in college life and won't be following his treatment plan as prescribed. So what might you recommend in terms of discussions and things that they can put into place in advance?
Yeah, really the biggest part is that whole starting the transition period early and beginning that education process early for why these the treatments and the disease and everything are so intertwined, that they really understand how they all work together. Oftentimes when you start it that early and they truly understand it, it becomes less of an issue. But only you can know your child, and there might be certain treatments that are more or less amenable to the lifestyle you think they're going to have. Perhaps remembering to take a pill every day is not the best option at that point in time if they are not, if you don't think they're going to take it, but it's just as bad not to show up for your infusion appointments. But the hope really is the education component, that they really truly understand what's going on, why it's going on, and if they can answer those questions and they understand it, then they will take that responsibility, hopefully. I do know that I've had patients, and when we started the process early, and when I say this, I mean before 14 years of age, it's not uncommon for them to go through those high school rebellious years where they rebel against showing up for infusions and doing everything they're supposed to do as well. And there's been a point in time where we have actually said, you know what? No, we're not going to continue this fight. You have to decide that this is important enough for you. And we actually did go on a predetermined break, and we got lucky with those particular patients because they immediately recognized a difference when they went off of the infusions and immediately recognized why they were important. Most of it was related to fatigue. Our patients immediately noticed that they didn't have as much energy, the fatigue was greater, and they wanted back on the ERT. But I know that's not for everyone, and that was a special circumstance with those particular patients, and it could have backfired in a big way for us. But we got lucky, and it did not, and those patients are now adults and are completely compliant with everything we have going on.
Oh, that's wonderful. Thank you for sharing that, because I'm sure it's very helpful to many parents. Okay, Allison has brought up that she recognizes that Gaucher disease is only one aspect of her daughter's overall health, and that there will be times in her life that there'll be more health issues that could arise that may not really be Gaucher related, right? But she would like to know, should she always be carrying some kind of, that fact sheet, number one, or that like key fob or whatever we want to call it, whatever that latest technology is going to be, so that she has it, things come up. And also how to help her determine when she really needs to contact the Gaucher specialist, right, for something versus just, I guess, the primary care.
Yeah, that's a great question. We spend a lot of time on that, and it really comes back to that whole education piece, really understanding Gaucher disease, developing that relationship and rapport with the provider that's going to be managing your care. And it is important to have a primary care provider. This is actually one of the more problematic things for us, is that the Gaucher provider can handle so many of the issues that come up for kids with Gaucher disease that they don't have the experience of a primary care provider in going to see, obstetricians and gynecologists, just getting a general health workup that involves cholesterol and other issues that may impact an adult. And so we spend more time talking about what is a primary care provider and how that primary care provider differs from the Gaucher provider, and that you really don't want your Gaucher provider providing your antibiotic for your sinus infection. You need that other provider. And so because of that, because you do need the expertise of other healthcare providers, it really actually is important, and why we have that flash drive or electronic record that talks about Gaucher disease and the treatments and their particular history and what you need to think about before you prescribe anything or do anything with the patient.
Wonderful. Thank you so much. Another question just popped up. How do you know when your child is ready to begin transition, 13, 14, right? What are some of the indicators that
In thinking about that, I was thinking about just my own. I do not have Gaucher disease, but I have another chronic healthcare condition that was pretty serious while I was growing up. And I tried to remember, did my mother do anything this formal with me? This is like awesome. And I will honestly say that nothing was done this formally, but what I do remember is that she was very open with me from day one. And so I went to every visit, and we were in the Air Force, and we had to repeat our medical history every single time we went to see any provider. And I knew everything about my condition in and out, and what had been done, and the dates, and how I had responded, and what had gone on, and just really had a good understanding of that. And that actually began when I was in elementary school. I have memories going back to before kindergarten of being in that doctor's office and answering questions, and that she really did let me have a voice in that room. She would give her opinion, but she would also make sure that I was providing my insight and opinion, and getting a chance to ask my questions about why different tests were important and what we were doing. And so, although we talk about kind of formalizing this plan as a teenager, I think it's really important to begin much sooner than that and helping them understand what it is. And it may avoid some of the rebellion that happens later on, maybe not, because kids are kids. But I just feel that I kind of forgot the question, but yes, I think starting early and starting.
Yes, starting early and involving them in the conversation, which is hard to do, but as parents, if we understand that ultimate goal, and yes, there's this more unique element when you have a child that has more of a medical need, a chronic medical need, and in this case, Gaucher. We really need to empower them earlier on. We know that they have that, the goal will be that we're transitioning them out from under our care into being self-sufficient adults, and that makes a huge difference. So I'm just looking. I don't see any more questions coming through, which is wonderful. I think there's just one other thing that I will point out. You had mentioned earlier in terms of options for supported decision making, and that really comes into play if you have a child that has the need for more support because of maybe some intellectual or cognitive disabilities that kind of go hand in hand. And that in those points, bringing your other healthcare providers into some of the conversation, they can help guide parents in terms of figuring out what other supports may be beneficial and helpful to the family as a whole and that child, and helping to promote independence.
Correct. And there's lots of written resources. There's kind of like an extended IEP that can be put into place, and things to think about in terms of more life skills to help them be completely independent. The Wisconsin Weissman Institute has some, like I said, fabulous resources on how to start that conversation.
Right. And what we're going to do for all of our participants who are listening in, and not only are we very appreciative that you're listening, and for those of you who have chimed in with some really important questions, this is recorded. We will be posting this on the website. We will be pulling out and putting some resources out there for you, and I will make sure that I send out an email to all of our program participants today once everything is ready and it's online and available for you to access and to take with you, because certainly there's so many wonderful points in here, Lori. Thank you so much. That keeping track of everything and taking it all in might need to be done in stages where you can keep going back and listening or using references that will come in handy over time, just like we are encouraging parents to do this check-ins at least annually, maybe every 6 months with their young adults as they're growing and maturing. And you're going to probably need to keep coming back and thinking about, oh, okay, well, those were the most important pieces at this stage of my child's life to address, and what's next? What should I be thinking about? Because I might not be thinking about everything all at once. So one last piece before we conclude the call for today, the webinar for today. I'm encouraging all of our participants, if you haven't done so, and you are able to join us on Saturday evening, October 27th in New York, 7:30 p.m. is our annual patient meeting gathering. This year it'll be a panel discussion and a champagne dessert reception. And please do RSVP and sign up. We would love to see you there. We have a really wonderful program that's being planned for everyone, and I think it will be very meaningful. So I thank everyone again for their participation, and we look forward to being able to offer more webinars in the future. We thank AvroBio very much for their generous sponsorship of this wonderful webinar and opportunity for our families. Thank you, Michelle. I just saw something pop up, and she gave me a little cue also. For those parents who are here and joining in, definitely we encourage you to be coming to this patient meeting, because we also have Lori who's going to be there, and she's going to be facilitating a teen meetup. And I'm sorry, I should have thought about that right off the top of my head. I was looking at the slide. She'll be facilitating a conversation with teens who are present for our teen meetup that evening, and it will be a wonderful opportunity for them, and it will be a wonderful opportunity for all of you parents who have participated today and joined in to have time to meet Lori in person. Thank you, Michelle. Yes, your daughter is looking forward to meeting the other teams as well, and I'm sure it's likewise. So thanks for reminding me of that. So as always, it's really a privilege to be able to work with this community, and any more information can be found on our website at gaucherdisease.org. If you have any follow-up questions, please don't hesitate to email me. We'll be more than happy to help facilitate getting the answers to your questions, and we thank you again. Have a wonderful day, everyone.
Thank you so much for inviting me. It was wonderful.
Thank you so much, Lori.